Hello everyone, this is Dr. Sakamoto. Today, I'd like to share a real-life example of someone who underwent regenerative medicine for diabetes. Let's start with the case of a man in his 40s. He had been living with diabetes for several years and was taking oral medication. A common blood test used to assess diabetes control is the hemoglobin A1C. In his case, unfortunately, his diabetes was not well managed, and his HbA1c was around 9, which is quite high. Diabetes can lead to a variety of complications. Some of the most common ones include diabetic neuropathy, which is a type of nerve damage that can occur with diabetes, diabetic retinopathy, which affects the eyes and can lead to blindness if untreated, diabetic nephropathy, which is kidney damage resulting from diabetes and atherosclerosis, a condition where the arteries become narrowed and hardened due to a buildup of plaque. When atherosclerosis occurs, all the arteries in the body can harden and become blocked. This can lead to conditions like heart attacks and strokes. He was suffering from diabetic retinopathy, one of the complications of diabetes. His ophthalmologist had told him, if things continue like this, you will definitely lose your sight. When he came to our clinic with his high HbA1c, we immediately started regenerative medicine treatment for his diabetes. In this regenerative therapy, we administer approximately 100 to 150 million stem cells. We conduct one course of treatment with 3 sessions. This patient also received one course. His main symptom was severe numbness in his feet due to diabetic neuropathy. He reported that his numbness improved by more than half approximately 1 month after the first stem cell administration. The second stem cell administration was performed approximately 1 month after the first. Following the second administration, he reported a further slight improvement in his numbness. His HbA1c level had significantly decreased from 9 to 7. The third stem cell administration was performed 1 month after the second. When he had previously visited the ophthalmologist, he had been told that he would go blind if his diabetic retinopathy was left untreated. However, after completing the third stem cell therapy, he underwent another examination by the same ophthalmologist, who reported that there were no signs of retinopathy and that his fundus findings had returned to normal. After completing the 3 stem cell administrations, his diabetic retinopathy was almost completely resolved, his foot numbness was significantly relieved, and his HbA1c level stabilized from 9 to 7. He was absolutely delighted with the results. We will continue to monitor his progress with regular blood tests while he maintains his exercise and dietary regimens. Now let's talk about diabetic retinopathy. This is a normal fundus examination. As you can see, there are many fine blood vessels visible. And this is the fundus examination of someone with diabetes. The blood vessels that are naturally present in the eye become damaged and blocked by diabetes. To compensate for the poor blood flow, new blood vessels form. These are called neovascularizations or new vessels. Because these new vessels are very fragile, if they rupture and blood accumulates inside the eye, symptoms such as a sudden red vision or a rapid decline in visual acuity can occur. Diabetic retinopathy, a leading cause of blindness, is a very serious condition. Even if you don't have any symptoms, if you have diabetes, I strongly recommend that you visit an ophthalmologist regularly. Today, we discussed a real-life case of regenerative medicine for diabetes. Thank you for watching the video.